Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. An important review article on vitamin D and respiratory tract infections was published several years back. The study reviewed data from 11 available placebo-controlled studies looking at the effects of vitamin D on the risk of respiratory tract infections in humans, which together included 5,660 patients. So it's an important analysis. Several important conclusions were drawn from the review of these studies. The first is that individuals with suboptimal vitamin D blood levels, that means a blood level below 75 nanomoles per liter or 30 nanograms per milliliter, are at higher risk for developing respiratory tract infections. However, the same is true for individuals with vitamin D blood levels above 140 nanomoles per liter or 56 nanograms per milliliter. So if your blood vitamin D level is too low or too high, the same thing happens. You're at an increased risk for respiratory tract infections. Now this makes sense, is you need enough vitamin D for the immune cells that line the respiratory tract to synthesize important molecules that actually pierce a hole through viruses and bacteria and other microbes that destroys them right on the spot before an infection can even start. At the same time, too much vitamin D in your system can to some degree impair the release of certain cytokines that the adaptive immune system relies on to fight infections should they occur. So this is why high doses of vitamin D have shown some success in helping to manage autoimmune diseases like multiple sclerosis, because vitamin D at high doses tones down the overzealous behavior of the T and the B lymphocytes that are known to exacerbate the inflammatory and demyelinating aspects of the disease, helping to put the patient into remission and to keep them in remission. Now, most people in our society have a blood level of vitamin D that's too low. Most people have a blood level below 75 nanomoles per liter, and they would likely derive an important immune-enhancing benefit by supplementing with vitamin D to get their vitamin D level above 75, a level that's associated with decreased risk of respiratory tract infections. On the other hand, taking mega doses of vitamin D, like 5,000 to 20,000 IUs a day, may elevate your vitamin D blood levels above 140, which is shown to actually increase the risk of respiratory tract infections, including tuberculosis in some countries. Now, it's also noteworthy that taking vitamin D supplements on a daily basis, like 1,000 to 3,000 IUs a day, as an example, is much more effective. It's a much more effective way to enhance immune function than to take large amounts of vitamin D weekly or monthly or every 3 months. Some people take, 10 to 20,000 IUs of vitamin D once a week, or 50,000 IUs once a month, or they take 100,000 IUs every 3 months. The reason that you don't want to take these high doses all at one shot is that the high doses of vitamin D entering the body at one time actually suppresses and weakens the immune system. Now, this may be a good strategy in certain autoimmune conditions, but it's not a good strategy to prevent respiratory tract infections across the population. So I've suggested for a long time that everyone should know their blood vitamin D level. If it's below 75 nanomoles per liter, then speak to your doctor about an effective daily vitamin D supplementation strategy that can get you above that value. If your vitamin D blood level is already above 140 nanomoles per liter, then you may be taking vitamin D supplement doses that are too high, unless your specialist has intended for this to be the case as an adjunctive measure in the management of an existing autoimmune condition. So I've included the reference for this information in the text below. Thanks for watching, and I'll see you next time.